Pulmonary edema is the key feature in the pathogenesis and prognosis of ARDS. Severity can only be indirectly assessed by the degree of hypoxemia as per ARDS definition. But to quantify the severity, it can be done either by the invasive method or with the help of CT scan. Neither would be practical for daily assessment. We know that chest X-ray is already in use to detect the presence of ARDS, and so systematically scoring of a chest X-ray can help to quantify the severity of pulmonary edema. The advantage is that there is no additional testing is required, no cost, it could be done without delay, and it also provides additional information about ARDS beyond that which is provided by the PaO2 or FiO2 ratio. So there comes the development of the RALE scoring, which is the radiographic assessment of lung edema scoring. It assesses both the extent and the density of alveolar opacities on chest X-ray. How to determine the RALE score? This is an X-ray of an ARDS patient. You divide it into 4 quadrants and start numbering as Q1, Q2, Q3, Q4. In each quadrant, you check for the consolidation score as well as the density score. You multiply both of them, and at the end you add all sum of Q1, Q2, Q3, Q4, and there you get the RALE score. So how to determine the consolidation score? Consolidation score extends from 0 to 4, and 0 being none, no alveolar opacities, and 1 less than 25, 2 25 to 50, 3 50 to 75%, and 4 more than 75% of the involvement of that quadrant. Coming to density, density score is from 1 to 3, and 1 being hazy, 2 being moderate, 3 being dense. And at the end, you multiply in each quadrant consolidation and density score, and you will get the Q1 score. Right side Q1, Q2, left side Q3, Q4, and you add all of them, Q1, Q2, Q3 and Q4. The value ranges from 0 to 48, with 48 being more severe and very severe. The diagnostic performance for ARDS is found to be excellent with the usage of the Berlin's criteria along with the usage of RALE score, which can be done at the bedside. The reason being, it helps in the assessment of the extent of pulmonary edema in patients with ARDS. Also, it helps in the response to treatment based on serial X-rays. It also helps in the identification of patients with high risk of mortality, leading to early detection, interventions and treatment. And also helps in the determination of severity of the disease progression in areas where there is shortage of facilities and specialists. So higher RALEs were associated with worse survival, and it can be done at bedside for helping in the early assessment and detection of ARDS. Thank you.